Hi everyone, I'm Dr.G, Nikila Reddy, Consultant Obstetrician and Gynaecologist from KIMS Cuddles, Secunderabad.
Hi everyone, I'm Dr. Navya Reddy, Consultant Physiotherapist at KIMS Cuddles, Secunderabad.
So today we both are going to discuss about exercises to be done during pregnancy. Before going into details, I want to talk a little bit about exercises during first trimester, because a lot of women wonder whether they have to do exercises during first trimester. And if so, what type of exercises they should be doing is what their question could be, like most of the times. So women, suppose if she's already been doing exercises before pregnancy, can easily continue her physical activities even though she is pregnant, because that shouldn't be tough for her for doing physical activities. But a pregnant woman, for the first time, if she has to start exercises during first trimester, should be tough, because she already would be dealing with morning sickness and nausea. So it's better that she does a gentle exercises during first trimester, that is first 3 months of pregnancy, because already developing a fetus in the womb, like a growing fetus in the womb, would be a new system for her body. And on top of that, if you start doing exercises, this again adds on the giving like a shock to the system. So it's always better to take an advice from a consultant before you start exercise during first trimester. And I generally suggest my patients to start doing their exercises during starting from the second trimester onwards. So depending upon this, I want to ask our expert opinion from our Dr. Navya, physiotherapist. So Navya, how do you think that these antenatal classes could be helpful?
Yes, these antenatal classes are very important for both mother as well as the father also. So antenatal classes will build up the confidence for birthing of the mother. It will also demystify many myths that are associated with exercises during pregnancy. So usually mothers, they come and ask, ma'am, can we do the exercises? Can we lift the heavy weights? Or we just need to rest throughout our pregnancy. So which is actually not correct. So you can exercise right from the beginning of your pregnancy, but the intensity of the exercises will be differing from different trimesters. So during first trimester, we give only certain set of exercises where we prepare the body of the mother to get adjusted with the physiological changes. And from second trimester onwards, we start her on a few selective stretchings. We address the symptoms or the pain that is related to pregnancy. Suppose let us say low back pain or any pelvic girdle pain, SI joint dysfunction, adductor tightness, then round ligament pain. So we tend to address these pains in the second trimester. And from third trimester onwards, we prepare her for the labor, where the labor preparation starts. Yes.
Okay, Dr. Navya, there are a lot of myths when coming to these exercises, because they have been asking like whether they can do weight training exercises during pregnancy, or if they have not done exercises till now and they want to start doing exercises for the first time during pregnancy. So what is your opinion regarding this?
Yes, a woman who has been exercising prior to her pregnancy can continue her exercise journey as it is, but with a clearance from the consultant. And those who have not started with any exercises, we first tend to put them on low impact exercises. So starting from basic breathing exercises, as we all know, then circulatory exercises, then gentle upper body workouts, and then lower body workouts. So as she is progressing towards the exercises, then we add on the difficulty level. Difficulty level doesn't mean that she has to lift 10 or 20 kgs of weight or something like that. Yes, we also do that training, but in athletic training where expectant mothers are an athlete. So the dosage of the exercises, I would say, would be different for different category of women. Yes.
And there are some pregnancies with complications where we don't advise them to do exercises. For example, like if suppose they are suffering from a chronic heart disease or lung diseases, we don't suggest them to go for doing exercises. Or pregnancy with complications like hypertension or diabetes, or women who has undergone cerclage because of the short cervix, or women who has a precious pregnancy or conceived with an IVF conception, previous history of multiple abortions, or history of placenta previa, that means the mass or placenta lying down, and history of any spotting seen during first trimester, or any history of bleeding through pregnancy. So for such pregnancies, we don't advise doing exercises during pregnancy. So what do you think about this? Are we correct suggesting these such type of suggestions giving to the pregnant woman?
Yes. Wherever the word exercise comes, there are always indications and contraindications for whatever kind of exercises we do. So, as told by Dr. Nikila regarding the complications of pregnancy, yes, we do take those, we consider those conditions and we give them exercises appropriately. If a certain woman is having a circular, suppose, we don't give her lower body workouts. We do more of upper body workouts, breathing exercises, and we tend to work on the back and core strengthening. Suppose if the mother is having placenta previa, so we don't give her any sort of strenuous exercises which is going to aggravate her symptoms or which may lead to spotting. So there are few signs where we we explain to our mothers when they have to stop doing these exercises. Suppose if at all they are overexerting themselves while doing exercises, they must be able to talk. Suppose if at all they are doing a simple clamshells, I would say. So they must be able to count the number of repetitions which we give them. Suppose if I'm giving a 10 to 12 repetitions of a particular exercise to a mother, they must be able to speak in between, like yes, 2, 3, 4, 5, 6. If this is the sort of exertion if they are facing, then we advise them to pause for a minute. Then we will break down the exercise into 3 sets. Like for 5 repetitions, you take a pause of 5 seconds. Again, after 5 seconds of repetitions, you take a pause of 5 seconds. Then completely cool down. So again, we give cool down exercises also. How important is doing an exercise, and at the same time relaxing your body is also very important. So we have exercises sequence where we follow that sequence in order to avoid this exertion.
Okay. So what do you think, like, these exercises would help pregnant women during labor, or how do they help during the pregnancy? Because as we say that when suppose a pregnant woman starts doing exercises, it improves their confidence during labor, so that they would be prepared for going through the labor process easily. Yes. Because they already, for the first time, the pregnant woman who has become pregnant for the first time, that doesn't know what is labor and how the process is going to be. So do you think that these exercises would help her for going through the labor pains?
Yes, so labor preparation work we start right from 32 weeks onwards, where we involve even the partner support in that. So partner support is very, very important to cope up with the labor and the labor pains. So everyone has this trauma, or they have this myths regarding the labor pains. We tend to see in movies, right? Whenever a mother is in labor, she shouts and suddenly husband comes. So it shouldn't be that way. The support of the husband should be right from the time of conception till the postpartum, because only mother is not responsible for the child, right? Yeah. Oh. Yeah.
Definitely.
Yeah. So in the labor preparation work, we tend to work on the pelvic floor. Then we work on the pelvic mobility, and we also involve few fun activities with the husbands. So that even that hormonal rush is very important, and a lots of cuddling of women. Then at the time of labor, the more than us, we would say that the support of the husband is very important. Okay, and we tend to teach the exercises to the husband first, and then we teach to the mother, so that even he'll be having an idea how these exercises has to be done and how he would support his partner.
Yeah, definitely. Yeah. That's why the partner role is very important. Yes. To say. Yeah. Okay. So, how do you start explaining the exercises to the pregnant woman? Is there any particular sequence that they should be starting with? Like how they start with like warming up, and what next, because suddenly they can't start doing exercises with the weights or doing some push-ups and all, because there are a lot of women won't be having knowledge about this.
So first we start with gentle warm up exercises, and then we go to the stretching exercises where we tend to improve the flexibility. After going to the flexibility, we tend, if at all the patient is having any certain conditions, as I have mentioned previously, we first tend to address those complaints. Then we would put her on a strength training. Like, we'll try to assess the tone of the muscle, like where we need to work out, whether it is adductors, whether it is the pelvis, or whether it is the sacrum. How the mobility of the pelvis is, how the tone of our pelvic floor muscles are. Though hormones take care of all these physiological changes, but few, though they are exercising, they tend to complain. Still, we find that tightness while exercising. How will this affect my labor? So this is how we tend to plan a sequence. So first starting with warm-ups, then selective stretching, then postural corrections, then proper strength training, core training, then pelvic floor strengthening, then perineal massage, then labor and the labor comfort measures. Like, there are certain positions which tend to relax women. So we concentrate more on relaxation exercises, smart resting positions, cool down exercises. Yes.
So, have you heard about this something called as aromatherapy and music therapy?
Yes.
So, what is your opinion about this? Do you think they work?
Yes.
And nowadays there is a trend which is going on, dancing and doing labor.
Yes.
So, which is the preferred way, do you think? So, does this aromatherapy and music therapy is going to calm them during labor?
So, whatever may be the measure, it can be a simple spiritual music, or it can be a simple hug from her husband, or it can be a music, or it can be an aromatherapy where we use different essential oils that will tend to calm mother. So there are many ways of what I would like to say is calming a mother during the time of labor. Whatever is suitable for, we can inculcate it. Doesn't mean that we need to infuse everything. For 10 minutes of aromatherapy, 10 minutes of music therapy, it doesn't work like that. It completely depends on the mother, what she needs. First, we need to understand what are her needs, what is comforting her. Then we need to give her what is her preference. Yeah.
Definitely. Thank you, Dr. Navya, for giving your valuable, and I think this should be a knowledgeable session, because being a gynecologist, I would be suggesting for my pregnant woman daily, you do this, you do that, do this exercise, but always hearing from a specialist mouth is better, I feel. So that's why today I want everyone to know like how exercises, stretches or whatever you say works during pregnancy. So for any further concerns or queries, please do visit KIMS Cuddle Secunderabad. We are always ready here to help you in all this process which you are going through. And Dr. Navya will be ready to explain you all the exercises and help you in doing all this, dancing, music, whichever, method you want. What do you say?
Yeah, definitely. So what our aim is here is to give you an overall positive birthing experience. Yes.
Please do join our childbirth education center in Cuddle Secunderabad.
So we are here to provide you with all the necessary services regarding your antenatal sessions, postnatal sessions, or your pelvic floor work also. So do visit us. Our expert team is always available for you round the clock 24/7. Thank you.